TB is a public health concern, and therefore TB is everyone's business. And what we say as implementing partners who work very closely with the Ministry of Health is to work collaboratively together to address this disease. So particularly in this COVID pandemic era, we have seen a bit of a strain on the health system because of the COVID pandemic. This has affected tuberculosis in many ways. We've seen a decline in the number of cases of people with respiratory symptoms such as cough and difficulty breathing who come to health facilities because of the stigma associated with these symptoms and the similarity to COVID. So as implementing partners and through the support of the USAID, Center for Health Solutions has been working very closely with the National TB Program to ensure that there is no disruption in TB services. The way we've done this, number one, is to make sure that all patients who are symptomatic, who have symptoms that are suggestive of TB, have actually been supported to move their samples from the peripheral facilities where they present to the gene expert testing sites, which are found and located in 189 facilities in this country. So ensuring that there is no disruption in diagnosis. Number two is ensuring that there is no disruption also in treatment. So the way we've been doing this is by working to ensure that we build the capacity of healthcare workers to keep thinking about TB even as they diagnose COVID-19, so that when a healthcare worker sees a patient with cough, fever, night sweats, that they go ahead and do a lot more work in establishing, does this person have COVID only, or could they also have tuberculosis? Lastly, it's in making sure that we create as much awareness as possible in the public and amongst Kenyans so that they can remember that TB exists and that some of its common symptoms include cough, fever, night sweats, and weight loss, so that should you have any of these symptoms, you should actually go to a health facility and, if possible, even demand for a TB test, remembering that TB diagnosis and TB treatment is free of charge in all public health facilities.